I was 7 when my mum died. She died of cancer. Even on her deathbed, she was saying, I don't want them to go into care, I don't want them to go into care. Unfortunately, when I turned 7, I had to go into care because there was no one else that could look after me.
Grieving for her mum Helen, placed into care, an abrupt end to Kim Memenyike's childhood. When she hit her teenage years, the relationship with her foster carer broke down.
I felt unloved, I felt like a paycheck. And that's quite hurtful because when you're part of this is all I knew. This was my network, this was my family.
In the middle of her A-levels, without warning, Kim says her foster carer told her to leave and that social services placed her in a hostel with people recently released from prison.
Both of my teachers actually helped me move from my placement to my hostel. I had aspirations of going to uni, going to Loughborough, studying international business, but yet I was living in an environment with people who had come out of prison for all kinds of charges. Some were rape charges, robbery, assault. I'm a young black female. That is not okay for me who is 17.
How can we transform the life chances of thousands of vulnerable young people like Kim? Today, a damning report says England's social care system is under extreme stress and needs a radical reset. The report has found that the number of children in care in England has increased by 25% in just over a decade. Over the same period, the number of child protection investigations has increased by nearly 130%. And without radical change, it warns, 100,000 children could be in care by 2032.
This review was promised by the Conservative Party in their last election manifesto. But critics say Conservative cuts over the last decade have stripped away services for vulnerable families. Add to that the effects of the pandemic and the cost of living crisis. Just as there are calls for a windfall tax on the profits of energy companies to help with fuel poverty, the report's author wants a windfall tax on the profits of private care providers to help fund change for the broken social care system.
Liverpool has one of the highest number of looked after children in the country, in some of the most deprived areas.
We've seen in recent years a real strong correlation between families under pressure financially and poverty and deprivation, and then referrals into social care. Last year, £90 million budget, we overspent by 14 million, and purely down to demand.
The report comes after the horrific killing of the toddler Star Hobson, and in another shocking case, Arthur Labinho Hughes. The trials of their killers highlighted numerous failings in the social care system. So what's it like on the front line?
You can often feel helpless, really.
Andy works in Merseyside and says during lockdown, some social workers saw their caseloads rise by 60%.
That the challenge to the general public is we're responsible in some way for evil people that commit these crimes to children. That can be quite difficult. Feeling helpless because of austerity, again, can be difficult because you can't put an effective safeguarding plan in place.
The government says it's committed to major reforms to improve the lives of the most vulnerable children and families. Despite and not because of the care she received, Kim Memenyike went on to graduate from university.
I'm not just a statistic. We are human beings and we've just come from unfortunate circumstances which are not our fault. It's not my fault that my mum died. I think as a nation, we should care.